Let me tell you a story. This is Hope. Hope decides she wants to pursue a health profession because she wants to help people. Hope works really hard studying and preparing to enter nursing school. She gets accepted at a top-tier nursing program. They teach her how to be a great nurse. Hope gets her first job at a well-known rehabilitation facility, treating patients with brain injuries and cerebrovascular accidents. Hope is placed on a healthcare team. As she interacts with the team, she realizes she needs to learn the roles of each healthcare provider on the team. She had a very generalized understanding of the role of physicians and pharmacists, and was not fully aware of the role of other professionals like chaplains, social workers, and occupational therapy practitioners. She does not feel she can speak up and offer ideas. She notices some providers take over the team meetings, some do not show up, and others are disengaged. She finds the meetings frustrating and ineffective, and she wonders if patients really benefit. Hope gets interested in this disconnect in her learning. She wonders, why did I not learn this in school? As she thought more about it, she realized, I see a problem here. We are all trained to think like healthcare professionals, but not as a healthcare team. She realizes healthcare providers are good at the I think, but not very good at the we think. Healthcare has a problem with we. Let's rewind. How do healthcare providers get from an I think to a we think mentality? Interprofessional collaborative practice has been identified as the appropriate model to implement patient care. This requires healthcare providers to think not only in their own discipline, but also consider and negotiate with a healthcare team. Facilitating the we means development of team-based clinical reasoning. Let's make it clear, we are not talking about healthcare teams as sheep, where everyone thinks alike. The core competencies for interprofessional collaborative practice call all healthcare providers to deliberatively work together. Let's consider Hope again, starting over with her story. Hope decides to go to nursing school. The college she chooses values interprofessional collaborative practice and is implementing some innovative practices for teaching and assessment, including team training, the interprofessional team reasoning framework, simulation, and service learning. These methods put practices into action. In addition to her nursing education, her institution facilitates interactions with other health profession students and practitioners. She learns about team-based care and how to be a good team member. She is challenged to consider not only her own clinical reasoning, but how to negotiate and collaborate with a healthcare team. She is even assessed on her ability to clinically reason as a healthcare team. Hope graduates and gets that fantastic job at the rehabilitation hospital. She is assigned to a team. She immediately gets to know team members personally and ensures she knows the roles of everyone on the team. She feels comfortable asking questions and being a member of the team. She values her own clinical reasoning, but knows that through team-based care, patients have better outcomes and are more satisfied with their care. She knows that conflict will arise, but she feels prepared to handle it. The reality is that we has a problem in healthcare. The problem is that we educate our health professionals only for their own profession. Students today are taught to reason I think, yet we need to mesh the I think with we think. This means professionals work together deliberately to develop a plan for patients presented by a team, and not decided by one or two providers. The Tying Teams Together Toolkit provides the tools to help educational institutions teach students to think in both the I and the we required for team-based care. So now, I pose a question to you. Will you join Hope in her journey from I think to we think? Will you help us develop healthcare professionals ready to work on a healthcare team upon graduation? Are we ready for we?